Hello and welcome to this webinar on instrument technique brought to you by Dentanomic. My name is Dr. Hannah Brown and I'm a general practitioner veterinary surgeon working in the UK. Everyone in the company of Dentanomic is either a veterinary surgeon or a veterinary nurse, and we aim to try to solve problems for people in clinics by innovating new technology and design to help solve those problems. When we started out with Dentanomic, we aimed to try to solve 4 issues. The first of which was the strain upon our wrists that an awful lot of veterinary surgeons experience when extracting teeth. The second was root tips fracturing when removing those teeth. The third was dentals being very slow and a bit tedious. And the fourth was blunt dental instruments. Hopefully we've managed to solve all of those issues, and by using Dentanomic instruments for your dentistry, you shouldn't have to suffer with those things any longer. Throughout this presentation, I will introduce you to the instruments themselves. I will then talk about the anatomy of the periodontal ligament and how we can use the mechanics of how the ligament works to our advantage when extracting teeth. I'll then go through the actual techniques themselves of elevation and luxation to extract teeth and periosteal elevation for raising mucoperiosteel flaps. And then afterwards, I will talk about the cleaning and the aftercare of the instruments to get the most out of them. So let's switch my cameras and introduce you to the instruments themselves. So we have here the gold kit, which is everything that's pictured here aside from the periosteal elevation set just there. The gold kit consists of 5 blades in the handle tray. The silver kit is 3 handles and the blades, and the bronze is 2 handles and the blades. The benefit of having the handle tray is it's a really nice place to store the instruments when they're loaded, and the lid of the handle tray comes off to act as a surgical table to put your suture material, any toothpaste, and I also put any extracted teeth in here so it keeps everything nice and clean and tidy. The handles come in 2 sizes, and this was to solve the first of those 4 problems of the strain that we experience on our wrists. We have the standard size or the long, and both sizes come in all 5 colours. The standard size handle has been designed for surgeons who wear a size 7.5 glove or smaller, and the larger size is for those who wear a size 8 or larger. All of the blades fit onto both sizes of handle. They come in sections and it's a modular design. You have the handle, the bolt which slides into the bottom, and then you choose your blade depending on the size of tooth that you're extracting. That goes into the top, and it has a double locking mechanism, which means it cannot come undone when you're operating because it screws up at the back end. These are the little keys which go into the groove on the bottom, and then my first tip is to hold the instrument vertically, keep the key still and twist the handle until it's finger tight. We designed the Dentanomic handles to be deliberately weighty and to sit into the centre of this big group of hand muscles at the bottom here, and that utilises the muscles that we've developed in clinic by drawing back on syringes and performing surgery, but takes the strain away from the wrist down here. They are ergonomically designed with indentations for your thumb and ring finger to improve the grip. And it should mean that your index finger is just a few millimeters from the tip of the blade, or potentially even longer than it, so you have that safety stop there to prevent slipping and causing iatrogenic damage. You want to have a nice bend in your finger if you're using the correct size handle. So if your finger is completely straight, it might be that the handle is too large and you need to go down to the standard size. It's deliberately weighty at the back, not only to utilise the muscles here, but also so that you only have to place your fingers very lightly on the tip of the blade to guide the blade into the correct location for precision and control. You don't need to apply an awful lot of force on there. So if you can see your fingernail going white, you're applying too much pressure, just relax your hand and let the blade do the hard work. These are extremely sharp instruments, and as such, when the blades are loaded onto the handles, please store them horizontally in the handle tray and not vertically. The blades come in a range of 2mm to 5mm for your elevation blades and 1.5mm to 5mm of your luxation blades. The little 1.5mm blade is amazing for feline reabsorptive lesions and deciduous canine extractions. This is my go-to instrument. With the Periosteal kit, which was launched very recently, they are in a range of 2, 4, 6 and 8mm, and you choose your periosteal blade depending on the size of flap you're creating rather than the size of patient you're operating on. We designed our periosteal blades after speaking to lots of vets at conferences who were saying that they were finding it difficult to raise a layer of periosteum underneath the gingiva without tearing through that delicate structure. So our blades are a completely unique design. They have a rounded contour with the sides on the top to protect the delicate gingiva, and they're smooth and flat on the bottom to protect the underlying bone. They have a very sharp chisel edge point, which helps to peel that periosteum off with ease. With the silver and gold kits that you can buy, you also get the honing devices just here. So let's speak for a few moments about the anatomy of the periodontal ligament space, and I'll draw your attention to my biggest model just down here. All of the models that we make are to scale based on radiographs, and this is in fact half of a cat premolar tooth. Just for some orientation, this is the pulp cavity down the centre of one of the roots. We have the enamel and the dentine. This is the periodontal ligament space, and you can see the ligament fibres and the vast network of capillary blood vessels that are located in this area. And you can see a little bit of the gingiva. This is the alveolar bone here and an adjacent tooth just there. And what I would like to draw your attention to is, even though this is hugely blown up in scale, the periodontal ligament space is still extremely small. And this is the area in which we are trying to insert our blades to operate on these ligament fibres. So we need something that is thin to be able to operate successfully. If we're using an instrument that is thicker than the periodontal ligament space, then we will have to either compress the alveolar bone or drill a channel into it in order to insert our instruments. With Dentanomic, that is not the case. And the reason for that is we designed our blades based on the anatomy of veterinary patients. So no matter what width of blade you choose to go around the tooth, the cross-sectional cutting height at the tip of the blade is always less than 0.3mm. And that is because the average veterinary periodontal ligament space is around 0.3mm up at the gingival margin here, and it narrows to around 0.1mm halfway down the length of the root, and then it does open back out a little bit towards the apex of the root to allow the vasculature in. So all of our blades are the same size or smaller than the periodontal ligament space in which you need to insert them to operate. You can see here the network of capillary blood vessels, and they're aligned in a lattice-like structure and help to absorb the shock forces that are applied onto the tooth in their own right, aside from the periodontal ligament's function. There's a huge amount of periodontal ligament fibres that originate from the cemento enamel junction up here, going onto the gingiva. There's a big strap that goes onto the crest of the alveolar bone, and then your transeptal fibres that go across to the alveolar bone as well. And you have some circumferential fibres in the ligament space itself as well. So when we're thinking about extracting teeth, we need to think about the anatomy that we're operating on, just as we do with any other surgical procedure we perform, but also the mechanics of how these ligaments and the other structures work so that we can use that knowledge to our advantage and extract the teeth easier. So let's think about the mechanics of the periodontal ligament. What does it actually do? Well, you can imagine that when movement is placed upon the tooth, either with the patient biting or chewing on a toy, the ligament is there to prevent the tooth from moving too far or too hard and bashing into that alveolar bone, which would probably cause it to shatter. So instead of moving quickly, the ligament slows down that force, but it has to operate very quickly in a very small amount of space. So any movement that we apply onto the tooth when we're extracting it is going to activate that ligament. And we need to think about that in the way that we move our hands when we're using our dental instruments to prevent us from activating the ligament and making it harder for us to extract the tooth. Elevation and luxation are the two techniques required to extract the tooth by working upon the periodontal ligament, and they work synergistically together. I feel most vets are quite confident with elevation. It was the one that we were all taught at vet school, to break the ligament fibres and create movement within the space, to move the tooth from side to side, a little bit like shouldering it across. Elevation is the process of tearing those fibres and thinning them down by fatiguing and weakening them. Luxation is a technique that a lot of specialists use, but actually it's a fantastic technique that anybody can use in practice, provided you have the right instruments and you've been taught how to do so. So that's exactly why I'm here today. Luxation is like a scalpel blade. It's a cutting motion that comes to cut through the ligament fibres. So it makes sense to use both of the techniques together to work faster. Elevation is going to thin and break down and fatigue the ligaments and make them easier to cut through with your luxation blades. And cutting through those fibres with your luxation blades is going to make it easier to stretch and break down the ligaments with elevation. So working with both techniques together will speed up your dental extractions. So let's talk about those in more detail. When we think about the ligament and the fact that it's great at dealing with rapid forces that are applied onto it, I like to think about the analogy of a seatbelt. If we pull a seatbelt quickly, it's going to lock up and prevent us from buckling in, just like the periodontal ligament. If we pull the seatbelt slowly and continuously, then we'll be able to click in and achieve what we need to do. The same is true for the periodontal ligament. If we move our blades quickly backwards and forwards in a drilling for oil motion like this, then the ligament is going to feel that movement upon the tooth and lock up to prevent it from bashing into the bone. So it stands to reason then that rather than moving our blades backwards and forwards and rocking them, if we insert them smoothly and then make a single turn, it's not going to activate the ligament as much, and that's going to make it easier to extract. So I'm going to change my camera again and show you the technique up close on my jaw model of elevation. When selecting your Dentanomic blade, have a look at the width of the tooth root you're going to be extracting and take a rough measurement. I think that this is around 6 millimeters in width at the gingival margin. So I'm going to choose my blade to be somewhere between 1/3 to 1/2 of the width of the tooth root. So I've chosen my 3 millimeter elevation blade. All of our blades are engraved with E or L for elevation or luxation, and then the number in millimeters, which is the width across. For the periosteal blades, they say P and then the number on them. I have my safe palm grip here, and my finger is close to the tip of the blade. From years in practice, if I place my blade at the gingival margin, I will be inclined to rock my blade backwards and forwards. And that's not only going to activate the ligament as we've just discussed, but also it will damage the Dentanomic blades. So rather than doing that, if I place my blade on the crown of the tooth and slide it forwards, pushing from back here in my hand and using my fingers just lightly on the blade to guide it into the right location, then I'm not going to activate the ligament because I'm moving slowly in one direction. Once I'm situated in that ligament space, I'm going to make a very small turn either to the right or to the left, but not both. Once I've made my turn, I'm going right in this case to move the tooth caudally. I'm going to hold that tension there for between 15 or 20 seconds. That's the average amount of time required to break those ligament fibres down, and also to empty the blood vessels in that capillary network so that you have compressed empty vessels to manoeuvre the tooth across into just a few fractions of a millimetre more. After 15 or 20 seconds, you can either increase the rotation in the same direction or remove the blade and come from a different angle and rotate in a different way. So here I'm on the caudal aspect and I'm rotating to the left, and that's manoeuvring the tooth mesially. Again, I'm going to wait for 15 or 20 seconds before moving the tooth a little further. Now do remember that this is a maximum of 0.3 millimeters of space in which you're operating within. So you don't need to be making really big turns, otherwise you will be compressing the bone, and that's going to be more painful for your patient and much harder work for you. Compressing bone is hard work. So just a very tiny movement. Remember, precision, not power, is the technique to be used with Dentanomic. Once I've done elevation for a short while, I might be ready to luxate. With my luxation blade, again, it's approximately half of the width of the tooth root that I'm extracting. And again, rather than placing it at the gingival sulcus, I'm starting with my blade on the crown, and I'm advancing it by pushing from back here in my hand and using my fingers just to steady the blade. And you do get a really nice feedback through the blade and the handle, so that you feel the blade advancing through the path of least resistance, which is the soft tissue highway, if you like, of the periodontal ligament space. Keeping the blade flat to the tooth root at all times, I'm then going to rock it side to side. In this mesial orientation, it's a little bit more like I'm going up and down, like I'm shaking somebody's hand. On the buccal and lingual aspects here, it's side to side, like a windscreen wiper in a car or a snake. And I hope that you can appreciate that the movement is coming from my wrist back here, and I'm not rotating the back of my hand. So luxation is the polar opposite of elevation. Elevation is all about a rotational force. Luxation is a lateral cutting motion with no rotation at all. Luxation then also means that it's a great technique for cats and small dogs, or any patients that you've radiographed and there's not a great deal of bone there and you may be at an increased worry of fracturing the jaw. Because you're not applying any rotational force with your luxation blades, there's slightly less risk of fracture. So if you have one of those teeth, such as a deciduous canine that you're extracting, and the tooth root is very delicate, then luxation is a great way to start, to cut down those ligament fibers and remove the tooth. And sometimes you can just luxate a tooth out if it's particularly weak. But if you've got a very large dog with a strong periodontal ligament, then starting with elevation is the best course of action, so that you can thin those fibers down and tear them away, and then it's much easier to extract the tooth afterwards. So choosing the technique to match your patient, but using both techniques together will help you to extract the teeth faster. With the Periostal Elevation technique, it's great for raising gingival flaps, and surgical dentistry is faster dentistry. By removing a layer of periosteum underneath the gingiva, it's not only easier to suture afterwards, because you've got that thick layer of periosteum to put your suture material through, there's less risk of it tearing through. But also, if this is your empty socket underneath, and when you've removed your tooth root, and this is the gingival flap on top, when the patient starts to eat, the flap will be compressed into that empty socket and put tension on your sutures. If you've got a thick layer of periosteum underneath your gingiva, then it makes it much stronger, a bit like a backbone or a support, so it can't compress as much, and that reduces the tension on your sutures. Additionally, if you're able to differentiate between the mucosal layer and the periosteal layer of your gingival flap, then you can create a horizontal releasing incision in your periosteum when you come to suture your flap, and that gives you a line of stretch to be able to close your flap without tension. So there's 3 benefits of the Periostal Elevation blades, and I will just demonstrate the technique now. So this is a sticker, and it's really easy to use something like a hand sanitizer bottle and try to remove the label off it. I'm just loading up my periosteal blade now. Placing the flat side down, you want to rock the blade backwards and forwards in that side-to-side snake-like motion, a bit like luxation, to get underneath your periosteum. If you feel like you are over the loose, less attached gingiva, or it's very friable, then you can increase your angle of attack. So it's just the tip of the blade in contact and work forward that way, and you're less likely to tear through. Once you've got a little bit of a corner, you can then decrease your angle of attack and advance a little bit faster. Once you've made the flap as large as you would like to, you can then use the rounded contours of the blade to lift and lever that periosteum off. And that means that you've got a really nice thick layer to suture up again afterwards. Once you've finished your procedure, you need to take apart your instruments in the reverse of the way you put them together, using your key to unscrew and separate out the bolt, the handle and the blade. And it's very important that you place these instruments into purified or distilled water. Tap water often contains elements that blunt all surgical instruments faster. This is especially true if you're using an ultrasonic bath, so make sure that you wash your instruments off afterwards with purified or distilled water. Once you've given them a scrub and got rid of any biological debris, then they need to be placed into an enzymatic cleaner. And it's important that that cleaner is pH neutral. Again, alkaline or acidic solutions will blunt the instruments faster, and they can damage the anodization, pretty colours on the handles. It won't affect the structural integrity of the instruments. They'll still work fine, but they won't look quite so pretty. That can either be in the enzymatic cleaner in a pot on the side or in an ultrasonic bath. And I do recommend putting the blades in the storage tray, which goes as a W shape and the blades are horizontal across it. And it's much safer to put that whole thing into the solution and lift the whole thing out than it is to be fishing around for individual very sharp blades. Once it's been in the cleaning solution, then you can put everything back in the trays, and all of our instruments are fully autoclavable on normal settings. There are two ways to look after your Dentanomic blades. The first is to hone them using the diamond card and the conical honing tool, which opens out like this. Honing is a more gentle, frequent technique which is designed to be done after each procedure, just to uncurl any metal. I don't recommend sharpening Dentanomic blades. The reason being is these blades are extremely thin and have been contoured for the anatomy in which you're operating, so they start very tall and thin. Sharpening removes metal to create a new sharp blade, so you can appreciate that as you remove metal, they will get thicker and thicker, and then you lose the advantage of Dentanomic, and they're less able to insert between the tooth and the bone, and you have to compress more of the bone to be able to get them in there. So I do not recommend sharpening these instruments. With honing, it does need to be done on a frequent basis, and it is a very gentle technique in which you have to get the correct angle to just uncurl that metal and preserve the thin tip. In my experience, honing is either not done or done at the wrong angle, and then you end up taking bits of metal off and you lose the advantage of Dentanomic. So I don't hone my blades at all. I just replace them a little more frequently. And that's one of the lovely things about Dentanomic, is that it is the modular design. You can keep your handles and your trays forever, and you just replace your blades as frequently as you need to, depending on the number of procedures you're doing and the level of precision that you require. So to solve the problem of blunt instruments, we have created the reorder service. This is an area of our website that you can register your clinic onto and choose the frequency that you would like new blades to be sent out to you from your regular distributor. We have the presets of either every 1, 3 or 10 months. Every 1 month is great for specialists or feline clinics or those wanting maximum precision and speed. Every 3 months is appropriate for the vast majority of general practitioners like myself. And every 10 months are for those who can spare the time to hone these blades after every procedure and are careful in doing so to preserve those thin tips. So every 3 months is about right for most people. The blades will be shipped out to you at that frequency that you set in fully recycled cardboard packaging like this, and your new set of blades are inside. You can take your new blades out and place them into the tray, and I would encourage you to put your old blades back into this packaging and use the free post envelope to send them back to your distributor, whether that's MAI or Icomire. And then the used blades can be melted down and recycled, so it's a much more sustainable method for the planet, and you know that you will always have sharp instruments to operate with every time. The reorder service is not a subscription. You can log in to your portal on the website and change the delivery day or the frequency. You can skip, or you can pause, or you can cancel at any time. You are in full control. And I find for me that it's just really nice knowing that every time I open my dental instruments, the blades are going to be sharp, and it gives me predictability about how long the procedure is going to take, so that I've regained my lunch break again, and it's much better for diary management. So just to recap, we have the 3 types of blade: Periostal Elevation blades for raising your gingival flaps, Elevation for stretching and fatiguing and tearing the ligament, Luxation blades for cutting through like a scalpel blade. And using the techniques synergistically together will make your surgeries faster and easier. The blades are thin and they work well because they're thin, but they do need to be replaced on a regular basis, and so we have the reorder service there to back you up. I fully expect that you will bend a couple of blades whilst you're getting used to the techniques, and as such we have a satisfaction guarantee. Whilst you're using the blades and getting used to them, within the first 30 days after purchase, if you do accidentally bend or damage the blades, we will replace up to 1 of each size of blade free of charge for you, and do another little short video with you directly one-to-one to try to tweak your technique and prevent the same issue happening with your replacement blades, to make sure that you're as happy as you can be. And if you decide that you don't like Dentanomic for whatever reason, then you can return the instruments within that 30 days after purchase for a full refund of purchase price. We want you to feel supported, and we are available. You can email us at any time or find us on our social media channels of LinkedIn, Facebook, Instagram and TikTok. So please do drop us a message if you've any questions whatsoever. Thank you very much for joining me on this webinar today, and I hope that it proves useful for you and that you enjoy using Dentanomic as much as I do.